My name is Saba Gondal. I'm a non-executive director at Black Country Healthcare Foundation Trust. For me, the COVID pandemic exposed and exacerbated the inequalities that exist within our communities, both for our staff, for our patients, for carers, and for the wider community. I think it was very confusing in the early stages with conflicting messages about what was in our best interests for health and care of patients and for our staff in terms of our duty of care towards them. I think what went, and that was exposed actually in the fatalities that we experienced in the first wave of the pandemic, where we saw the first deaths in health and care being Black and minority ethnic professionals. I think for us, what worked well was traditional institutional barriers were removed. People galvanised quite quickly in order to do the best they could to deal with the problems on a scale that was unprecedented. The commitment of our staff and the ongoing commitment of our staff, because whilst the pandemic feels like has ended for the wider community and society, it continued for us as healthcare professionals much longer in terms of Omicron and subsequent variants as well. In terms of lessons learned, I hope that the things that we did well during the height of the pandemic are bedded into our daily practices. I hope we don't return to institutional boundaries or professional boundaries, and continue to develop our services in an integrated and innovative way that are centred around the patient, their carers and families. And we always have in the frame of our mind the health and the safety and the well-being of our staff who are delivering these services on the front line.
Hi, my name's Alice, and what went well during COVID was how us as human beings, we just connected and we worked together. And it just showed our true values, particularly for our workforce at NHS, who were at the front line and was going out there day in, day out to support the communities and the patients. What I think we learned from COVID was the health inequalities it creates and the barriers, and it's kind of heightened our awareness on where we need to focus on, because if we can tackle health inequalities, we can nip it at the bud, and that will support us in the bigger system working in population health.
Hi, I'm Nafisa. I'm director and co-founder of the Association of South Asian Midwives. So what went well during COVID? COVID for me, I was unfortunately shielding. So what went well for me was the value of family around you and the family of community around you, and how COVID brought communities together to help each other and to sort of tackle the situation and support each other. What didn't go well was the fact that COVID, as we know, really highlighted and shone the light on inequalities within healthcare, and how the inequalities really had negative impact on our communities. And for me, I'm a midwife, so it was the maternity outcomes that really, really highlighted that. You know, we live in the UK with the best health service in the world, and yet Black women are 4 times more likely to die in pregnancy, and South Asian women are 2 times more likely to die. Now that is, not good enough. So we really need to tackle the inequalities agenda and keep the momentum going, because COVID has allowed that to happen. Thank you.
Hi, I'm Will Hopkins. I'm Staff Equality Network Coordinator for Birmingham Community Healthcare Trust. For me, I think what went wrong in the COVID pandemic was the misinformation from the government. There were lots of mixed messages saying stay at home, go to work. It wasn't clear. You can use public transport or you can't. So that didn't really help people to manage in a situation that was really confusing and very challenging as well. I think what also went wrong in the pandemic was from our own trust, a lack of communication. I expected probably like an emergency briefing, or for our human resources department really to give more clear information to all staff, about what was happening, because we were getting messages on television that we should stay at home, but then still being told that we have to attend to go to work. So that wasn't helpful at all. I do feel that there were some other good things that happened from the pandemic. I do feel that the government did respond in a way very, very quickly by setting up a vaccination programme and getting that robust, having vaccinations at things like cricket grounds, supermarkets, rail stations. I thought that went really, really well. I think from a personal perspective, the trust that I work in, they did a BME risk assessment for me, which was really good, and they made sure that, looked about my health and well-being to make sure that I wasn't put at any, increased risk, because I classify myself as from a BME community. I also found that the trust was supportive, as I use public transport and they provided me with PPEs, that was masks, so that was to reduce my risk of contracting COVID, so that was really good. I think I'll leave on a positive note, those are my observations regarding the COVID-19 pandemic.
So, first of all, let me talk about the good things that went well with the whole rollout during the pandemic. I think the public have been absolutely fantastic. They got the message, certainly in the first wave and the second wave of COVID, that staying at home, social distancing, cleaning your hands and face masks, all that sort of thing, the public were exemplary. I wish the politicians were as good as some politicians as good as the public were. The other thing was, of course, Rishi Sunak announced the furlough, and there was furlough money for people, businesses, which helped to support them. I thought that was really good. The vaccine rollout was good. We were the first country in the world to produce the vaccine, so that went really well. I thought the volunteers for the vaccines, people just coming and helping out in these vaccine camps, cricket grounds vacated, tents put up to roll out the vaccines, the GPs, the pharmacists getting together with the nurses. I thought that was fantastic. It's a great example of how we can work together on that. And the other thing, of course, was we suddenly woke up to the digital world, which helped us to be working remotely, made better sense. It probably would have helped climate change as well. So lots of good things about that. Now, so what about what didn't go well? Well, there were many things that didn't go well, unfortunately. Elderly patients being discharged prematurely to care homes, and one paper put it as a headlines as discharged to die, and that was really unfortunate. The BME deaths, particularly in the earlier part, BME health workers dying, the first 14 doctors to die were from a BME background, insufficient protection for healthcare workers. After all, it was about saving the NHS, but we should have saved lives with BME frontline workers as well, right from the beginning. So that was a slow response by the government to that. Also, the Nightingale hospitals, £400 million, I understand, was set aside to help with the Nightingale hospitals. I thought that was excessive, particularly as the Nightingale hospitals weren't really used very well. The vaccine rollout, while I was saying that was good, but at the end of the day, about £8.3 billion was stated in the BMJ as money that was, because of the rollout, everything, there was £8.3 billion that could have been saved from a more efficient way of doing this. The other thing was, of course, disinformation about the whole lot, how the virus has come, all sorts of stories. The disinformation about the vaccine caused vaccine hesitancy, particularly in the vulnerable communities. That was all very unfortunate. I think the other thing that didn't go well was Partygate. Politicians should have shown exemplary behavior. The role models were lacking there. and there was a conflict between science and politics, which is just completely unnecessary. We should have just simply followed the science. I think in the future, what we're going to have to do is to understand better the role of the vaccine, if there is one, and I think there ought to be science coming out, prevention of the vaccine. We need to have better preparedness for a future pandemic. We're not out of this one, but we certainly need to be better prepared. And also, I think what is really in the community that's going on, the disadvantaged communities, and the politicians talk about levelling up. That levelling up really needs to happen, otherwise the social determinants of health will make it even more apparent. Deaths, morbidity, mortality will increase.